So welcome to Frontier Nursing University's DNP information session. My name is Dr. Khara Jefferson, and I am the program director of the DNP. I am also joined today by Miss Karen. Do you want to introduce yourself?
Hi, I'm Karen Brumback, and I am an admissions officer, and my daughter, my 6-year-old, is with me. So I apologize. She's supposed to be being quiet and being in the background, but she's not. So
Nope, that's fine. Thank you.
thanks.
All right. So at Frontier, we have both students who are already in our MSN program who are joining us, as well as students who are interested in the postmaster's DNP joining us. So for the newer people, our mission here at FNU is to provide accessible nurse midwifery and nurse practitioner education to prepare competent, entrepreneurial, ethical, and compassionate leaders in primary care to serve all individuals with an emphasis on women and families in diverse, rural, and underserved populations. And we take this very seriously because it's in everything that we do. So today in this information session, we're going to cover, well, why do you even want to come to Frontier? And more importantly, why should you get a DNP? We will go over the programs of study for the DNP, the admissions criteria. We'll answer questions about the DNP project, how to get started, and go over a bit of the nuances of DNP advising. So Frontier is, of course, a distance education program, and part of our program involves something called the culture of caring, where we like to treat everyone. I used to have a little card sitting up here on my desk, but it was moved. We like to treat everyone exactly how we would want to be treated. So with professionalism, with respect, with mutual support. And we expect the same from not only faculty and staff, but also from students. Your home community also becomes your classroom because we're with you wherever you can carry that laptop. You are able to access our courses from the comfort of your own home, from vacation, wherever it is that you are, you have access to us. You study on your own time, which means we do not, for most things in our DNP courses, things are asynchronous, meaning you don't all have to be logged in at the same time. There may be cases where you actually must be logged in and ready to answer questions, but that's a rarity. And of course, you travel to beautiful Versailles, Kentucky for the DNP program one time for something that we call DNP Bound, which is your orientation session, unless you're a companion student. And we'll talk about that a little bit later. So here are a couple of photos for those of you who may have heard of Frontier prior to the last couple of years. Our campus used to be in Hyden, Kentucky, but recently we built this beautiful, beautiful campus. And we're so excited to finally start using it because COVID impacted that. But these are just a few buildings on campus and what they look like. But the main thing, the purpose is to show you that we kept some of the same style elements that we had from the buildings in Hyden. So what is it about Frontier that keeps people coming back, and what have we achieved? Well, we have over 80 years of experience in graduate nursing and midwifery education. We have students and alumni that come from every state in the United States. We have well over 8,000 graduates, and our educators have lots of knowledge in education, so we know how to teach. We've also received several awards. We have been named one of the best online programs in 2022 in the U.S. News and Graduate Nursing. We have also been earning top colleges for diversity honors for a couple of years. And FNU also received an International Distance Learning Award in 2021. One of the other things that we are really proud of is our level of student support here at Frontier. We make sure that there are online student groups. You can also have student-to-student support. So students who are ahead of you in certain classes, or even when I think about student council, they are typically available to answer your questions. We have faculty who serve not only as the faculty role or the primary faculty role in courses, they're also mentors. We offer financial aid. We also have 3 brilliant librarians who are always ready to help, especially our DNP students, as you are coming up with literature searches for your project. And then, of course, we have the Diversity Impact Program, which is a conference that we hold on campus. It's a great, if you have the chance to go, I truly would encourage you to be able to do that because it is truly a great experience. We also support students in the form of scholarships. So our scholarships are available during the spring and fall term. They're available during those award cycles, which means that, you know, people are like, well, I wanted to apply for a scholarship right now. We have deadlines for when you can actually do those things. So keep that in mind. You also must have a minimum of 24 credits earned with us here at Frontier before you're eligible for a scholarship, and you have to have a GPA of at least 3.25 or higher. The amounts of the scholarships vary, and there are over 20 scholarships available. And as you can see, that great statistic right there, in 2021, we awarded over $700,000 worth of scholarships. So if I were you, I would definitely apply when that pertains to you, because that can take a little bit of that financial burden off of you and your family, which I think is very important. So as I said earlier, my name is Dr. Khara Jefferson. I am the director of the Dnp program. I have been at Frontier for 5 years, and I actually obtained my Dnp from Frontier, from this very program. I think I was in the second class doing a quality improvement project because we had just converted over from a capstone project. In the DNP courses, you will find that we have what's called course coordinators, and the course coordinators are like the managers of the course. So if there's a problem in the course faculty, because the course faculty are assigned students, sometimes the course coordinators too, but if you have a problem with your course faculty, the expectation is that you would go to the course coordinator first. And then if you and the course coordinator can't solve a problem, then you come to me as the program director. We also have academic advisors that you meet with during DNP Bound to help you formulate your academic plan of study. We have financial aid officers, and then, of course, we have our credentialing coordinator who's specific for the DNP currently to help you get your clinical site credentialed, because that is where you will do your DNP project. Everybody together makes up your support team, and we all work closely to ensure that students feel well supported and know who to turn to during the different avenues of your journey. So why should you get a DNP? Well, our DNP, as I said before, it is all about quality improvement. And quality improvement is important. And maybe you've been doing it for a long time and you just didn't know that it had a name, quality assurance, some people call it process improvement. So it's got quite a few names. But the reason it's so important is because we know that it takes an average of 17 years to implement new knowledge in clinical practice. We also know that the textbooks that we've had people buy, when I went to school, everything was about textbooks. We didn't really get a whole bunch of that online. It was you had to buy the physical copy of the book. But we know that by the time something is in print, it's typically outdated for a textbook. But with quality improvement as one of your foundational levels, it allows you to develop experience to not only improve care, but to also assume greater leadership roles, which is really important. You also have real world implementation. So quality improvement is all about, you know what, we're going to try this. We're going to see if it works. What did we learn? Did it work? when it worked, what went well, what didn't go well, what do we need to change? All of those things are aspects of quality improvement that you will learn a little bit more in our program. And of course, your DNP is a terminal degree. So your DNP is a more of a clinical doctorate as compared to a PhD, which is more research based and research focused. There are some admissions criteria in order to be accepted into our DNP program. You must hold a Master of Science in Nursing, a Master's of Nursing, one of those degrees. You also must have a current, active, unencumbered, registered nursing license in the United States. So if you don't know whether or not you have encumbrances on your license, I encourage you to go and look at nurses because it will tell you, it will pull it all up. You also must have a GPA of 3.0 from a master's level program. And don't worry, there are periods of this presentation built in for you to ask questions. So let's talk a little bit about the programs of study for the DNP. If you have attended Frontier in the past or are currently attending Frontier, so let's say you attended Frontier and you graduated 2 years or less ago, you would still be considered a companion DNP student. If it's been more than that time, then you fall into the postmaster's DNP program. But the thing that I want to highlight here is that the companion DNP program is 21 credits because those students earn 9 credits from their MSN program here at Frontier. But within those two, there are 2 plans of study. There's a 12-month option, which goes by really quickly. And then there's a 15-month option, which that goes by quickly too. But the nuances of, if you're asking me from a program director standpoint of how students, how successful students are between the two, it honestly depends on where you are in your job. Students are typically encouraged, if you are starting a brand new job, the places that it really matters becomes in your actual DNP project courses. And that's the 4 courses, PC 739, 740, 743, and 744. And don't worry, we'll look at all that in a minute. But if you are just starting a brand new job when you're going to be entering those, the first of those courses, it's not recommended that you think you're going to finish in that short amount of time because you're going to have a really hard time getting buy-in from a site, and become fully onboarded to that site. Whereas if you've already had some time to onboard, the people, your project process becomes a little bit easier. The same would apply to postmasters, but like I said, the postmasters is 30 credits because you actually have to add back in the 9 credits that the companion students have already taken. And it's the same thing when we look at the 15-month versus the 18-month option, because that's the question that I get over and over and over again. Which would you recommend? Well, if you are working full-time and have a whole bunch of family responsibilities and very little time on the side, I definitely would not recommend a 15-month program. So it's all about looking at priorities. And we also spend a lot of time talking about this during the DNP bound session. Our terms are 11 weeks and there are 2 week breaks in between each term, which some students want to do work to get ahead in courses. I always encourage rest and actually getting to know your family again because it's graduate school. And so there's a certain level of commitment that you will actually have to put forward in order to make it work. But this is all very, very doable. Also, as y'all see in the red, the plans of study are subject to change prior to your admission in the DNP. So we always use that as a caveat because who knows when things will happen. Was I supposed to click on those links? Do you know? We'll come back to them if we have questions later. So there are a couple of things that you need to know. The upcoming application deadlines are June 22nd, and that coursework actually begins on October 3rd, and then September 14th, and that coursework begins winter 2023, which is in January. And there are quite a few steps to the application. So first, you actually have to submit the online application. There are also a couple of essays that you must write. I know one of them is a time management essay. I can't remember what the other one is. You will also submit your resume. So if your resume is something that's been hiding on your computer and you haven't updated it within the last 5 years, this is a great opportunity to whip it out and get it in tip-top shape. Add those extra bonus things that you've done to that, because that's what actually makes you stand out above other people, because we do look at that. You also have to submit your transcripts from any other institution you've been at and have a few professional references. Our DNP program, like I said earlier, we have something called DNP Bound, which means that you come to campus for a 2.5-day experience if you're a postmaster student, or you do a 1-day virtual DNP Bound if you are a companion student, because you've already attended an on-campus Frontier Bound. We have 6 courses that are fully practice oriented in the DNP, and you do your DNP project over 3 terms. So if you look at it, your actual project takes place over 33 weeks. Our tuition, actually, there was an approved tuition increase, so that may need to be changed, but I think tuition right now, when you guys will start, is $6.46 per credit hour instead of $6.36 per credit hour. So how do you begin? Well, you will, this language the students always have questions about, but you can be a direct admit for those students who are currently enrolled in our MSN program or any of our postgraduate certificate programs, or you are an external applicant, meaning you have not attended Frontier in over 2 years, and you're a nurse practitioner or a nurse midwife who wants to now get a DNP. So you would go through the standard admission process. And so, as it says here, the method that you will follow depends on when you graduate and actually when you begin your DNP courses, because we have some flexibility built into that. So now is the time to take a break, and we will answer any questions you have specific to admissions. We're going to hold off on specific questions related to the actual DNP program and the DNP project until the second half, because I go into that in the second half of the presentation. Please feel free to unmute, because I do not see the chat box right now. So unmute and speak to me so I don't feel like I'm in this room by myself.
Hi, I have a question. It's Rachel.
Hi, Rachel.
Hi. I was wondering, I filled out the admission application for direct admission while I was enrolled, and now I have completed my MSN. So it was at Frontier, and so I didn't ever hear anything back from that, but I never got to the like the essay portion or anything. I'm not sure if I did it wrong or if there's like something that I was supposed to hear back from them before I was graduated, or what, or now I have to go through the whole process again.
So I will leave that up to Karen to answer, but I do know that I'm not sure when you applied, but recently we switched from our older admissions process to a rolling admissions process. And so that means that if you submitted an application a long time ago, you probably will have to go back and do another one. Am I correct, Karen?
Yes, it just depends upon when she did it. Now, if she did not submit her essay portion, then it would be considered an incomplete application. So it would not, of course, have been processed. However, somebody should have reached out to you to let you know this. But that's okay. If you want to touch base with us in the admissions office, we can look at your application specifically and tell you what you need and, you know, get you going where you need to go. So you can contact, I believe your admissions officer might be Tasia, but I'm not 100% sure. So if you would like, I can put my email in the chat and you can contact me directly and I'll get you where you need to go.
Okay, thank you so much.
Great.
Hi, my name's Ariel. I had a quick question.
Sure.
Regarding the if you're a companion and you just finished your master's in one term, are you able to start the DNP the next following term?
So you would have to complete the application, correct?
Yes, and usually that link is sent out to you in like your final semester or final semester or two. And or you can just go online and apply. We try to get you to where you roll through, but you have to fill out the application first that we know that you're interested.
Okay.
And the other part of that I will add is if you are completing your MSN here at Frontier, the primary courses that you have left, a whole bunch of them are mostly your DNP clinical courses. You do have another couple of courses, but in order to start your clinical courses, you must have passed boards. So just depending on the timing of when you'll take boards will determine your actual plan of study.
You are given 1 semester grace period to pass the board. So you can start without having passed your boards in that first semester, but you will have to show us proof of board certification within that first semester.
Okay, sounds good. Thank you.
You're welcome.
You're welcome.
Any other questions? I'm in my second semester of mental health, MSN. When can I apply for the DNP program?
IT will send out an email to you, just letting you know that if you're interested, you can apply for it. And it's like in the last semester or two of your program. So you won't be getting it anytime soon. So definitely when you're further into your clinicals, you'll get something about that. And also feel free to reach out to admissions just to check and see when's a good time to apply, and we can help you with that.
So we have 2 years after graduating from a Frontier Master's program to apply for the companion program. I don't love that wording. That wording makes it tricky. So the way that it works is you were considered a companion student if you roll right in, but if you, let's say you decide you complete your MSN program and 3 or 4 years go by. So when you come back to Frontier, it's a lot of it has to do with our accreditation process and how that whole thing works. But technically you would be now, because you're outside of that window, you would be considered a postmaster student. So you would do the full application process.
I'm sorry, Khara, for the admissions process, it's if you have been enrolled since 2014, it's very tricky. The terminology is very tricky. Since 2014, you would be eligible for the companion program. You have to come back to campus if you've been out longer than 2 years.
That's
so there's that. Anything prior to that would be postmasters, or if you did not get your MSN with us, that would also be a postmasters DNP. It can be very tricky. That's why it's always good to reach out to your admissions officer for specifications for your situation.
See, that's why we have her here, for her to explain this to me. Any restrictions to provide distance learning to Florida residents? There are none that I know of. I can tell you that when you get to the DNP clinicals, the situations with Florida, some of the situations that have come up are more to do with credentialing, because apparently in Florida, you guys have some laws that state that you don't have to have malpractice insurance, like it's optional, but you have to actually have it for our DNP program. So that is that's the only Florida hiccup that I've run across. Any other questions related to admissions?
Hi, yes, just as a follow-up regarding the Florida stuff. So I'm in Florida, I'm in Miami. I get my malpractice insurance from my employer. So if I'm gonna be doing my DNP with my employer, which will be the plan, that will cover me, or do I have to get an extra one?
That's a great question.
Mhm.
And you are covered by your employer. So as
Okay.
long as your employer has malpractice insurance that meets Frontier's limits, you will be fine.
Okay, perfect. Thank you so much.
You're welcome. Any other questions? Okay, well, we might circle back around to admissions by the time we get to the end. I saw that there were some people who were in another room. Now that I had access to the chat, I hope everybody's able to get over. So now we will actually start talking about your DNP program questions, because I know students always have a lot of questions about that. And some of this also kind of goes into the courses a little bit. So our DNP program has several didactic courses, and those 6 courses are Epidemiology and Biostatistics, Nurses Educator, Principles of Independent Practice, Evidence-Based Practice, Health Policy and Advocacy, and Leadership and Organizational Dynamics. The ones with the asterisk next to them, PC 702, 713, and 718, are courses that our current MSN students take. But our postmasters have to just add those 3 courses on. Each course gives you practical things that you can do now so that you can actually start improving your clinical practice now. It's not fluff. We don't have fluff courses here at Frontier. Every course kind of gives you a new perspective on something. And once you get to the DNP clinical, all of those, you're going to use things that you learned in all those other courses. So you can't just kind of take the course and forget about it. It will come back. You will see it all again. So just keep that in mind. And then we have what I call the DNP clinical courses. I like to think of these as one big giant course, but because we have 11-week terms, we had to break it up into tiny digestible chunks. So PC 739, that is your DNP clinical prep course. And in that course, you will do exactly that. You will become prepared for clinicals. So you will identify who your project sponsor is, who your project mentor is, because we do not have preceptors for our DNP clinical project. We have instead sponsors and mentors, and there are criteria that go along with that, and you find that out once you get to PC 739. PC 739 is also where you do your credentialing for your site. So that's when we find out, oh, your site may not have that liability insurance, or, oh, you're acting as a volunteer, so you actually must go through the entire clinical compliance. You also earn a basic certificate in quality and safety that you can add to your resume. It's one of our claim to fame here at Frontier, because there are not a lot of schools who are doing that. But we have purposefully front loaded those courses in PC 739 to take the extra work out of all of the work you're already going to be doing in PC 740, 743, and 744. There is a time commitment. So as I talk about this, you'll also get this again at Bound, but PC 739 is a 1-credit course and it is pretty self-directed. So I have students who have finished with PC 739 last term by the end of week 7. I think I have a couple of students who are on track to do that this term. PC 740, 743, and 744 are your traditional courses. And so you move through them one assignment at a time. You can't really go fast because each assignment builds up on the next. And our assignments are built so that they are more formative assignments. And so in the beginning of each one of these courses, your assignment point values are intentionally smaller than they are as you go through the course. You must spend about 20 to 30 hours per week in the planning course on actual course materials, getting your data, talking with your site. This says at least 1 day per week on site. And so let me clarify what that means, because that's also another place where people have questions. If you work there, of course you're on site, either 3 days, 2 days, however many days you work there. What we mean is you must spend, it's generally more than 1. So plan for 2. You will spend 2 days, however many hours. So it might be 2 hours here and another 4 hours here, outside of your regular work duties, looking at charts, meeting with your staff or whoever is part of your project, doing your actual work where you actually need to be involved with those other people and have them involved. PC 743 is actually where you implement your project, and you implement your project at least 3 days per week on site. So if you work there, easy peasy. You're implementing your project into your regular workflow. You will still need to make time outside of that to complete your assignments, maybe go back in to get your data collection. But it's a little bit more difficult if you're volunteering at a site and you also have a full-time job. If you're volunteering at a site and you have a full-time job, you have now also got to fit in 3 days at this other site, because you cannot be a project manager if you're not on site. So your time commitment is a little bit more for implementation. And then PC 744, that is our dissemination course. And I tell people that you can expect to spend about 10 to 20 hours per week on the work for the course. The only requirement, there is no clinical, you must be in site component, except for your final DNP presentation. The expectation is that that will be an on-site event, because you didn't do the project for me. You didn't do it for the Frontier community. You did it to help your patients and those people at your site. And I know people will have questions about that, and we will get to those later. So how do you select a project topic? Every project must be based on evidence-based guidelines. So we talk a whole bunch about this in PC 739 about what do you do? What are the first steps? But I can tell you that the first step is, this is not your passion project, right? For some people it may be, but for the vast majority of our students, at least 95%, it is a project topic that was agreed upon by site leadership, their quality improvement committee, their service director, whoever that person is in charge of that department. Our projects are all population focused with patient outcomes. So you cannot do a project where it doesn't affect patients. We've had lots of people who have been in educational roles and they're like, well, I'm an educator. Can I do this with the other educators and my site? No, you would actually have to likely work at your school's clinic or be a volunteer at another clinic offsite from your school in order to do our project, because it must occur in the clinical setting. Our projects also focus on the Institute of Medicine 6 quality domains of healthcare. Your project won't focus on all 6, but all projects are built in with a patient-centered focus. And generally, we have you look at equity now. Each project also contains an element of patient engagement and team engagement, because we know that in order to impact change, number one, you need patients to be active participants in their care. And number two, you can't do it by yourself. It takes a whole team. And so the entire team kind of needs to work together to figure out what you're going to do and what your next steps are. Your project topic must also solve a daily problem. So what does that mean? Well, my project was a perfect example. My project was on pre-participation sports physical exams. And my project could have been very disastrous had I started it one term later, actually, for implementation, because it's a seasonal thing. For most places, students only get pre-participation physicals at the beginning of the school year, or sometimes they go into the fall. But another one of those dangerous topics are things like influenza, because we have students who do projects on vaccinations, and some of them want to focus on like a flu vaccine. And so you have to be mindful of the timing and map it out to when you will actually be implementing your project. So in pre-planning, what happens is you come into PC 739, and I'm the course coordinator of that course. We go over the expectations of your project. I schedule you during the second week of the term with a faculty advisor who works in the Dnp program, and they meet with you for a 30-minute session to give you individualized counseling and feedback on your project. And so what does that mean? So there's pre-planning that goes involved in the pre-planning, because you've got to come to that session already having completed a form that tells the faculty this is your idea. You only put one idea on that form, but I usually encourage people to come with 2 ideas in case they don't approve your project. You also discuss your actual program of study. Number one, is this the right time for you to actually be taking PC 739, or is it better for you to put this on hold for a term because you've got some major event or something coming up in your life? We also discuss life, work, and school balance to help you better organize yourself to see what will actually fit best for you. You complete a clinical site approval form, and that's when you also get your credentialing done to get your site approved. So
I'm confused. I can't talk.
whoops, can we mute? We discuss all of that. The
Oh,
other important thing that we do in your individualized counseling session is we discuss with you, does your project have the potential to need IRB, Institutional Review Board, approval? People who are generally in larger settings, like some hospital systems, generally do require you to go through IRB. And so if that may be you, or if you're thinking about it, it is something that you need to mention in this meeting, because we actually have to plan for this and see how this will actually affect you in your site. I just had meetings with at least 3 students because they needed to have IRB. And sometimes we have to meet with the site to make sure that their system is congruent with what we have for our courses. So that's it in a nutshell. If everybody wants to go through their DNP speedily fast, and that's great, right? And it's great if you actually have the time built in, but we also know that people have lives and you have families and you have other things that you would like to do. So people want to go fast. So if you look at this quote by Henry Ford, if I'd asked people what they wanted, they would have said faster horses. We always want to do things faster, but faster does not always mean better. And so when you're making these decisions, think about what your goals are for your life and let that guide you. What you will soon find is that I am an advocate of anything dealing with self-care. And I will always, always, always advise you on the side where you actually get to obtain self-care rather than you making yourself sick trying to accomplish getting your DNP quickly. So here are a couple of things that we want you to consider as you plan ahead. Do you have a potential clinical site? Maybe you do, maybe you don't. Are you working? If you're working, you should implement your project, if possible, at the place where you're working, because it just makes the whole process so much simpler for you. Um, you can also implement in either your registered nursing role or in the APRN role. You just have to, as we discussed earlier, you have to have passed your boards by the time you get into those clinical courses. And the timing of your job is important, because if you are transitioning to APRN practice and you are transitioning at the time where you will be taking PC 740 and PC 743, we generally will not approve you. The DNP faculty will not approve you, because we know that the students who go through that are our students who tend to be unsuccessful from years and years of doing this term after term. You don't want to start a new job because it's a time commitment, and you don't want to learn a whole EMR, a whole new process, at the same time learn process improvement. It's just a big recipe for disaster. Do you anticipate any major life events or life changes? Because if you do, that is also something to consider. Let me tell you why that becomes really important. The way that our catalog is written, you must take PC 739, which is your pre-planning course, the term immediately before you take PC 740. So if you take PC 739 this term, and at the end of PC 739, something happens in your life. Maybe you've been pregnant this whole time, and then you are about to give birth and you will be away from your clinical site. I would tell you at the beginning of PC 739 to drop the course and take one of your other DNP courses that you haven't taken before, because if you cannot go straight into PC 740. PC 739 is a repeatable course. So I can put you in it once, twice, 3 times. You take it over and over, but it must be taken in the term prior to PC 740. So pre-planning and looking at your life ahead of time is especially important, because we don't want to waste your money and we don't want to waste your time with you having to take a course multiple times. And what are those extra responsibilities that you must have at home that you absolutely must do? All of that is very important in determining your actual plan of care. So I have a couple of spotlight stories, and we'll take questions after we get through this, but we have Mr. Early. Keith is a psychiatric and mental health nurse practitioner. He is just starting in the DNP courses. He's actually in PC 739 right now. And he said that he was excited to research and possibly publish data that can help those struggling with substance abuse disorders. He chose Frontier because we're nationally ranked, we have strong core values, and a long history of success in distance learning, which we do have. And so we're excited to work with Keith, and we're excited to see where that goes. We also have Dr. Sibylla Myers. Sibylla is great. She graduated from Frontier's DNP program. And now she has been faculty with us for at least almost a year. So it's almost a year that she has been with us. And her quality improvement project actually was altered because of the COVID pandemic. So she did a wellness project, and her big thing was that she altered lifestyles and helped people to renew their healthy habits. The great thing, and is what we hope that you achieve from your DNP project too, is we want people to make lasting changes, things that are sustainable. We don't want you to do something that you're going to forget about as soon as the project is complete. We actually do want this to be meaningful to you, your site, your community, and your patients. So the distance between who I am and who I want to be is separated only by my actions and words. So you and only you get to make that decision, and you and only you get to decide how much work you want to put into this, how quickly you want to go through this, how slowly you want to go through this, and actually how much effort you want to put in this. And because this is a doctoral level program, we know from experience that there will be obstacles. There will be doubters. You will make mistakes, but as long as you work hard, there are no limits to what you are able to achieve. And you will be better off on the other end of this, because you will now have an entire new skill set that you can do so much with. If you have any additional questions, especially pertaining to financial aid, you can contact financial aid at frontier.edu. If you have admissions questions, you can contact admissions at frontier.edu. And so we look forward to working with you and seeing you successful at the finish line for commencement. And we really are your cheerleaders in this program. The support, I can't stress enough about the amount of support that you will get as you go through the program, especially in the DNP, because I know that Frontier has a lot of other programs, but we really put you with continuity faculty so that you have one person as your go-to at all times. So what questions do you have? I will stop screen sharing so we can answer questions. Talia, I see your hands up.
Hi, thank you for the presentation. I'm wondering if the DNP program is taking New York residents. I know the master's programs are not currently.
Yes, great question. And yes, we take New York students for the DNP program because you're already at an APRN. And so it's different. You're not competing for clinical sites because chances are you are already doing this at the site in which you work.
Amazing. My follow-up question is, are there restrictions on the size of the practice for your clinical projects?
So we don't have restrictions on the size of your practice. We have a restriction on your patient volume that you see in a week, because in order for us to say that our projects are population health focused, that means that you should be seriously considering a project where you'd be able to take at least 70 to 80% of your population through the first intervention that you will create. So what that looks like is, if let's say on an average day you see, I'm just going to throw a number out there. Let's say you see 20 people a day, 20 patients a day. That means that you would like to have at least 15 of those people be able to go through your first intervention. Maybe they qualify for the next one, maybe they don't, but you can screen everybody, right? So bare minimum, as of this moment, subject to change, as of this moment, the expectation is that you will see a minimum of 20 to 30 patients per week dealing with whatever gap you have in one intervention. Does that make sense?
Yes.
And we discussed a whole bunch more of this at DNP Bound, because this is where a whole bunch of the questions come.
Great, thank you.
You're welcome. All right, Cherith.
Hi, yeah, I just have a question, and I apologize because we were in the other waiting room, so I apologize if you covered this already, but it seems like the DNP is very much geared to like family nurse practitioners. So I was wondering, if I'm an established acute care nurse practitioner and I'm coming in to do one of the certificate programs, is this a good fit for the DNP based on, you just said you have to see at least 30 patients do the interventions. I'm working in an ICU, so sometimes that's not always feasible. So
Correct.
how does that work with acute care?
So this is a great question, and it's one that I don't get asked often enough, but is really important. So for acute care, we have had multiple students do acute care projects in the past, and they have been successful. So actually, this is not fully geared. This is not geared at all just toward FNP students. I will actually tell you that the vast majority of the students currently in DNP are actually psychiatric mental health and not family here for us at Frontier. But we have had students who work in a clinical, in an environment. Some, I think there have been a few projects in acute care areas. I can't specifically think of an ICU only project topic off the top of my head, but we've had students who are either hospitalists or working acute care who are like, you know what? I don't have that patient volume on my unit, but I can actually include this other unit because it's the same hospital. And so I'm now having a project on a different unit. So as long as you are there, it works. It works for people. Hope that helps.
Hello, Dr. Jefferson.
Yes.
My name is Jessie, and I have a question, please.
Okay.
I heard you talking about having sponsors or mentors.
Yes.
Is that similar to a preceptor, or is that different, or do we have to
It's-
act? Sorry.
Yeah. No problem. So it's similar yet different. So once you get into PC 739, I give you this, you have a couple of forms to fill out. One of them is a teacher learner form. You also get what we call a sponsor mentor agreement, which outlines the role of your project sponsor and project mentor. And then there's also a clinical site form that outlines to your employer or whoever that you're bringing this to, the actual responsibilities and what our project looks like, because some people get worried about some of the things that we do, like you will have team and patient surveys, and it's not to say we make you do these things so that your team and patient, so that your site looks bad, right? No, it's so that you can find gaps. Everything that we do is all about gaps because everything must be data driven. If you aren't tracking the data, you cannot realistically figure out whether or not you have a problem. So we have you do those things and we outline them. In a preceptor role, like you had when you're in your MSN program, you have somebody who is overseeing you, right? And making sure that you're doing the right thing. In your DNP role, you don't need a preceptor because you are the project manager, and quality improvement, a lot of it is trial and error. So our sponsors and mentors are designed for them to be people who will be there to support you along your journey. So one of those individuals should be somebody who has experience in quality improvement. The other one of those individuals should be somebody who actually has experience managing people, because there is no such thing as a perfect quality improvement project or a perfect team. We know that you will run into some obstacles. The key is having people who are on your side who can guide you as to what your next step could potentially be. How do you engage your team more? How do you troubleshoot this other problem? Because you may not know every last resource at your disposal, but they do. And so that's why we have those people. And we also have you submit a copy of their resume just so that we can make sure that they meet our qualifications.
Thank you.
You're welcome. Meredith.
Hi.
Hi.
I am a midwife, so it
Mhm.
sounds like I might be in the minority of this, and I had a very similar question. As far as patient population, I am actually a laborist-based midwife that does hospital-only floor time. And my question was twofold. One, as far as local on-site people that I will be working with, is there an expectation that one of them, some of them, would also have a DNP credential already? And then also, as far as school advisors, are you typically paired with somebody in the same specialty? So I would be with CNMs if that's where I was trying to focus my improvement project.
Great questions. So to answer your first questions, you are not in a minority because we have lots. In fact, over, I think half of my DNP clinical faculty staff are midwives. So you're in very good company. In the past, we trialed a system where the faculty, your continuity faculty, which means the person who grades your assignments, was the same specialty as you. Well, we don't have faculty for every single specialty. We also determined that it didn't work because all the midwives were together, which means that they didn't get some of the other things. And what we have learned is that you have a much richer DNP experience when you are paired with a diverse group of people. So when I am assigning your DNP preclinical advisor, I don't take into account what your specialty is, what their specialty is. If there are problems and we need to bring in, or there are questions and we need to bring in somebody in your specialty, then we arrange those meetings. But all faculty are capable of advising you for everything, because it doesn't matter, honestly, what your topic is. The main thing that we're looking for is your volume. The volume is one of the most important things in determining whether or not you have gaps. So there is still an opportunity for you to have mentorship from, ask questions to some of the other faculty, because we reconvene after all of the meetings, and then I officially assign you somebody starting for PC 740. As far as, do they have to be DNP prepared? So one of your sponsor or your mentor has to have a leadership role. So that means that they have to be DNP or have a credential equal or higher than yours. So, but not both of those people. So actually, I think it's master's level or above. So that's it. They don't have to even have a DNP. Does that make sense?
Yes, it does. Thank you so much.
You're welcome. Any other questions?
Hello,
I have a
Dr.
question.
Jefferson. Oh, sorry, go ahead.
Oh, sorry. I wanted to know the statistic course that you took during the MSN program. Does that have to be within a certain years to be accepted?
So I am not sure about a certain year. It depends on, so let me go back and say this. There are sometimes courses that are too old. So if you took a course, let's say you took statistics, or are we talking about epi and biostats, or are we talking about just statistics, to clarify?
Yeah, just statistics. I think we took that in during BSN.
So I know that there was a criteria in the past, and Karen would have to answer me about statistics. Nope.
We no
So,
longer require
there
statistics.
you go. So it's no longer required. So that means that once you so your statistics won't be an issue. It's epi and biostats that you will take once you're with us.
Okay, thank you.
You're welcome. There's also a question that says, is the DNP program offered each term? Yes, we offer every single course, every single term here at Frontier, which also separates us from some of the other schools. So there's not ever a period where you could get off track and say, oh no, I have to wait another 9 months before I can take this course again. No, you can take it the next term. I think Jesse had another question. Or maybe not. Anything else? Well,
I had asked if you're taking Texas residents.
oh yes, we take residents from all of the states in the United States. We also take students who may be living internationally, but they must have a licensure in one of the United States in order to be accepted into our program. And then, of course, meet all those other criteria. Can I please explain PC 744? Absolutely. So PC 744 is our evaluation and dissemination course. And so when you look at the progression in PC 740, you planned your project. In PC 743, you implement your project. And so there's not a whole lot of time to analyze your findings. PC 744, the beginning is when you actually sit back, well, you kind of start that at the end of PC 743, but you actually sit back and you now look at it and say, okay, what does this all mean? And so we teach you how to, we really hone in on what we call our 4S concepts: standardization, sustainability, spread, and scale. So that you understand how your project is impacted and what you can do next. Then we have you write up your quality improvement findings in something called Squire format, which is the way that you report quality improvement findings. You have revisions of that paper. But based on that paper, we have you put together a PowerPoint, which is the same PowerPoint that you will use to present to your live audience and your faculty or virtual audience, those stakeholders. And you also have a storyboard, which is a poster that you have to take with you that you can go and apply to any conference to disseminate it. So it's really putting everything together so that you have actual products that you can do something with. You can choose later on to work with your continuity faculty and publish. That's a whole lot more time and energy after you get out of school, because it's not built into the course. The purpose of our DNP program is not so that every student publishes. There's only a small fraction of students who want to publish. Our program's focus is really to teach you quality improvement that you can take and apply to any other project topic after you finish. Does that help? So it's a little bit less time intensive for some people. Some people love PC 744 and some people do not. It depends on whether or not you like to write and do public speaking, rather than some people's favorite course is implementation because they're actually insight doing. Some people are those doers, other people are writers. So it just depends.
Dr. Jefferson, I have a question about just kind of the timeline of what most students choose. I'm currently in the CNET program.
Okay.
And I'm kind of weighing out what I want to be choosing once I'm finished. Do most students choose, who are interested in doing the postgraduate certificate, like the women's health, for example, do they choose that to go into prior to the DNP, or do they do it concurrently? What does that look like?
It's a mixed bag. So the rule at Frontier currently is that you cannot be in two programs of study at the same time. So you can't be like a women's health postgraduate certificate program and the DNP program at the same time. So they do one and then they do the other. And the order does not matter. We've had students who do it either way. They either go get their PGC and then come into the DNP, or they get their DNP and then apply for the PGC.
Okay, Dr. Jefferson, can I add here, please?
Yes.
If she is doing the MSN, the midwifery program, she would be eligible to do the one additional clinical course to get her postgraduate certificate in women's health. And if you do that, you can do your first semester of the CDNP concurrently with that. That's the only time we allow that to overlap, but it's only if you're doing the women's health completion.
Thank you, guys. Thank you so much.
You're welcome.
Anything else? So if there are no more questions, I guess my final parting words are, we have great faculty, we have great staff. Everybody's great, honestly. Everybody's great. Everybody's friendly. Bound is an experience where you will meet people who may become your best friends for life. It's people that you remain in contact with long after that experience. But we are just a really supportive community, and we just want to support you on your educational journey. So my best advice is if you are thinking that you want to do our DNP program, that you start looking at the application, look at the application deadlines. We have a rolling admissions process. So the earlier, like the sooner you get all of your requirements in, the better. Like you will know sooner than you normally would have with our older admissions process. So we really encourage you to do that.